Yeah, I am Dr. Parameshwar CM, CEO and founder of SMILES International Institute of Colorectal, Bangalore. Globally, about 50% of the world's population is suffering from different kinds of colorectal problems, more in the West. This is because of different lifestyle across the globe. When it comes to India, about 36% of the Indian population suffer from different kinds of colorectal problems today, currently. About 50% of the population in India suffer from any one of the colorectal problems at least once in their lifetime. The alarming trend in globally is the colon cancers are slowly increasing. According to American College of Colon and Rectal Surgeons, by 2030 there will be 30% increase in colon cancers in 30 years age group. The same thing with the way the lifestyle, the digestive diseases are progressing in India, in 50 years down the line, if we don't take actions now, we see the same trends in India in the coming 50 years. So in India, about 36% suffer from colorectal problems. There are major challenges in India to handle all these things. There are different kinds of colorectal problems like piles, fissures, fistulas, constipation, colon cancers, and inflammatory bowel disorders like ulcerative colitis and Crohn's disease. So whenever patients have these problems, somehow in India there is a social stigma attached to these problems. There is a taboo attached to these problems. People feel very shy. They have some kind of fear in seeking medical help. And an average about in India, every person, every human who suffer from these problems suffer in silence for about 9 years time before they seek medical help. So whenever they seek medical help, they don't go to medical practitioners proper. We have about 1.5 million quacks in this country in different names practicing across the nation. So people go to quacks and quacks make a patient's life miserable. They have different kinds of practices to treat these problems, like some people use some powders, some people use some acids, some people use some bullock horns to dilate the anal canal, and some people use different kinds of threads, and really they make patients' life miserable, and many people have committed suicides due to intervention by quacks. So this is one of the major challenges. There is no awareness on colorectal problems in the country, whom to seek for medical help. And women who defecate in open air defecation in India today, about 52.1% of population still don't use toilets. So when you defecate in open air, they are more prone to this colorectal problems, because whenever they defecate in open air, especially women, it is either before sunrise or after sunset. In between, they suppress the act of defecation. So when they suppress the act of defecation, towards the end of the day, when they defecate, there is a lot of strain on the anus and rectum, and people are prone for fissures and hemorrhoids. So women have to really handle very properly, and this is a major challenge. And also pregnancy issues, where fissures and hemorrhoids are common in pregnancy. Women just feel shy to share this problem even with family members. Another one is, none of the national health programs in the country have addressed colorectal problems so far. So we've been discussing with the policy makers in the country, with the NITI Aayog, Ministry of Health, to include this as one of the national programs in the nation, so that we can prevent majority of the colon and rectal problems and promote well-being in the rural masses and the Indian population. This can also be one of the major program with Ayushman Bharat. SMILES, the journey started in the year 2011, when one of my surgeon friend, he himself being from a prestigious medical college, landed up with a quack and had to damage his sphincters. So seeing him suffering from losing control over the stools, we thought to start the colorectal practice, and we started the first work in Mandya in the year 2011. So after that in 2014, we made it exclusive colorectal specialty called as SMILES. SMILES, people say come with piles and go with SMILES. So SMILES is Silicon Valley minimally invasive laser and endoscopic surgeries. After 2014, we did the first pilot in Mandya for 5 years. We worked in 5 districts in old Mysore region. We covered about 26 lakh families in association with Indian School of Business, Dan Foundation, LV Prasad Institute, Arvind Eye Care. Together we formed the Equitable Healthcare Access Consortium. So through this consortium, we have reached about 26 lakh families in the last 5 years. In 2017, we incorporated and started SMILES International Institute of Coloproctology. So right now we have about 3 centers in Karnataka. We will be, and so far we have operated about 18,000 procedures. We have seen about 6 lakh OPDs and impacted 26 lakh families. The exclusive institute for colorectal, it was the first time in the country. You go to any hospitals, you have a GI department. For exclusive colorectal institute as a single specialty, this was the first time in the country. Healthcare is moving towards a focused factory approach. So the focus is, you do the same work, you do little work again and again, you become excellent in that. So we are a process driven organization, we are a protocol driven organization. We have the most advanced diagnostics and most advanced procedures in the country. We are the first people to introduce 4th generation laser machines to treat colorectal problems. We are the first in the nation to introduce manometry studies designed by Mayo Clinic. So basically it is exclusive, it is inclusive, it is technology driven, and our clinical outcomes are excellent because of focus. The latest advancements in colorectal is we have this treatments for different kinds of colorectal problems. Generally, when we go for conventional surgeries, we have seen patients suffering for about a month, beyond a month in some cases. So there is loss of labor, there is loss of pay, and there is a huge economic and social impact on the family. So the advanced procedures like lasers, DG Halrar, it's a decade procedure and absolutely painless, and majority of the people get back to work in 48 hours, where the suffering is reduced for about 4 weeks. The future plans is, we need to touch every life in this country with the philosophy of touch every life. So to bring awareness on colorectal problems, to bring awareness on colon cancers, to bring awareness on open air defecation, to bring awareness on women and colorectal problems, especially colon cancers. Colon cancer is the only cancer which is diagnosed in end stage. About 78% of the colon cancers are diagnosed at late stage simply because people with simple bleed neglect or ignore as a simple piles problems. They'll end up with quacks. They'll end up with different kinds of practitioners who will not diagnose colon cancer as early stage. So our main aim is to bring awareness on colon cancers and colorectal problems and make sure people suffering from colon cancer are diagnosed early and early intervention is done. Colon cancer is the only cancer which can be treated completely if diagnosed early stage, and it can be prevented with different lifestyle modifications. So we want to do intervention at the school level, intervention at the workspace level by involving with Government of India, make it as a national program, take it to every doorstep in this country. As an institute, we want to start centers across the nation, make sure that colorectal care is affordable, accessible and advanced to every family in this country. So we want to train colorectal surgeons in this country, we want to train colorectal nurses in this country. We are in preventive, promotive and curative care. Make sure colorectal care is advanced, accessible and affordable to every single family in this nation.